Stroke kills about twice as many women each year than breast cancer does. As a matter of fact, stroke is the third leading cause of death among women. It may surprise you to know that women have a higher lifetime risk for stroke than their male counterparts, and they're also more likely to die from a stroke. A stroke is an attack on the brain. It happens when the blood supply to part of the brain is cut off. The effects of the stroke vary depending on which part of the brain is affected and how severe the stroke is. May is National Stroke Awareness Month. The more you know about the symptoms of stroke in women, the better you'll be able to get help. Quick treatment can mean the difference between disability and recovery. Some of the symptoms women may experience can include nausea or vomiting, seizures, hiccups, trouble breathing, pain, fainting or loss of consciousness, general weakness. Because these symptoms are unique to women, it may be difficult to immediately connect them to stroke. If you're a woman who's unsure whether your symptoms are that of a stroke, you should still call your local emergency services. Last May, we spoke to Dr. Nitza Alvarez at Tri-County Heart Institute about what women need to know about stroke. We felt that message was important enough to share with you again.
The first thing that women need to know is that they are at higher risk of having a stroke compared to men. Women tend to live longer than men, therefore we're at higher risk just by age alone. If you're older than 65, your risk for stroke increases. We know that when a woman has other conditions such as atrial fibrillation, they are at higher risk of having a stroke. So any woman should be looking for what risk factors they have that increase the risk for stroke. Do you have high blood pressure? You have high blood pressure, you know you're at higher risk for having a stroke, therefore you should seek medical attention for that. Do you have high cholesterol? Are you diabetic? Do you live a sedentary life? We all hear about my neighbor had a stroke, my family member had a stroke, this person had a stroke, and I know that some of us are capable of recognizing some of the symptoms when a patient had a stroke. I think that is easier when there are obvious signs like I cannot talk, a part of my body is weak, or I have a droopy face, versus more subtle signs of a stroke, which can be like a short-term lapse memory, all of a sudden I didn't remember, or short-term vision loss, where transiently I didn't see well, but then because it didn't last, I didn't pay much attention. Stroke is a lack of blood flow to a part of your brain, and that lack of blood flow, it can be because of a clot that occluded that vessel, or because of bleeding, the rupture of a vessel that is not letting the blood flow get there. The brain needs nutrients, needs oxygen. It's a very vital organ, and seconds of not having those nutrients or oxygen that needed to be delivered there can translate on death of that tissue, which subsequently gets manifested with deficit that we can see in our patients. I think that more important than anything that we can do to identify or treat a stroke is how can you prevent a stroke, and knowing if you have any of the risk factors that I just mentioned give you the power to recognize and be proactive in preventing or treating them. Around 5 million women live in this country with consequences of stroke. So if you know your risk factors and you are proactive in identifying them, that will help you be away from that statistic.
A stroke is an emergency, and it can happen to anyone, at any time, at any age. If you know the signs, you might be able to help save a life. Remember the important acronym: FAST. F, facial drooping. A, arm weakness. S, speech difficulties. T, time to call emergency services. Living an active lifestyle can lower your risk of stroke and stop or even reverse the buildup of plaque in the arteries. Join Dr. Alvarez every second Saturday of the month for Walk with the Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. Be sure to follow Tri-County Heart Institute on Facebook to confirm the walks have resumed. You'll find information on Dr. Nitza Alvarez and the Tri-County Heart Institute when you click our story link icon, Women's Stroke, online at yourhometownhealth.com.